Welcome to this episode of Focus On, as all eyes are on the inaugural International Health Ministerial Summit being held in Kigali, Rwanda. This summit has brought together global visionaries and policymakers from 20 countries to discuss the state of healthcare, pressing challenges, as well as forge innovative solutions. Stay tuned for key conversations and insights from this summit. So to just kick us off, how is Roche supporting the development of diagnostic tools that are tailored to Africa's unique healthcare challenges?
So, Flora, the first thing to say is that Roche has built a very big ambition for Africa, specifically on the diagnostics division where I work. 3 years ago, we built an ambition to increase the number of diagnostic tests we bring to the continent tenfold over a 10-year period. We estimate we were reaching 50 million people in Africa in 2021. We want to reach 500 million people by 2031. To that end, we are moving forward with a very strong partnership approach to overcome the many barriers of access to diagnostics that we see in Africa. Today, less than 20% of Africans have any access to a quality diagnostic. This is tragic because the question then becomes, if we are not testing, what are we treating? It's imperative that companies like us should have an ambition like that is commensurate with Africa's focus on reaching universal health coverage. We partner through the entire spectrum, from research and development to addressing building of strong, resilient healthcare systems, and then finally landing quality products in the continent. We recently made an acquisition of a very good point-of-care platform, or a platform that you can use in primary healthcare settings, your dispensary, your health center, and so on, called Lumira DX. This is a platform, a testing platform that was developed primarily by the Gates Foundation, and we are going to further develop it and also bring it to Africa at scale, as an example of how we are investing, not just in terms of bringing the innovations we have today, but also in how we change our innovations to have a better fit in the continent.
And while solving the healthcare challenges that we have within Africa, it cannot be a one-man show. Therefore, what is the position of public and private partnerships in all this?
Yes, if Africa carries a quarter of the global health burden today with just 1% of the global health budget and 3% of the global health workforce, these are huge challenges. And again, these are just numbers, statistics, but they are as real as a heart attack for many patients out there. Just this year, we're going to lose 250,000 women to cervical cancer in the continent of Africa. That is going to be 90% of all cervical cancer deaths in the whole world happening here in the continent. I could go on about HIV, I could go on about malaria, tuberculosis, and the other non-communicable diseases that are killing many people in Africa today. Government alone cannot solve it, private sector alone cannot solve it, academia alone cannot solve it. We have to come together. We have to improve our trust deficit. We have to have strong government stewardship to give direction, universal health coverage, and here's the roadmap on how we're going to get there. And as stakeholders, as partners, we have to come to the table with a win-win mindset. We win, all the stakeholders around the table win, and most important, the patient wins when we achieve universal health coverage in Africa. So as Roche, with the big ambition that we have to increase the number of diagnostic tests tenfold in Africa over the next 10 years, we're approaching Africa with open arms and saying, we can't achieve that ambition that we have on our own. It's aligned with Africa's ambitions. So let's work together.
And talk to us about specific projects that you've done. For example, you've talked of cervical cancer and looking for solutions for the likes of HIV and AIDS. In 2024 alone, what specific things that you've done as Roche that the world needs to know about?
Well, there are many. I don't know where to start. So I think the most important one that I should share is what we've done in the area of HIV/AIDS. And it's a long play because, again, our 10X strategy, as we call it, is a long play as well. Many people who grew up in Africa will remember that in the late 90s, early 2000s, it was a huge challenge in Africa, and we lost millions of people to this devastating disease. A lot of responses to it today you cannot diagnose clinical AIDS in the public domain. We have contained it both from a diagnosis perspective and also from a treatment access perspective. Roche played its part in that. Over the last 10 years, through a partnership program that we call the Global Access Program, Roche has grown our diagnostic platforms in 42 countries in Africa, so that today we're responsible for at least 50% of all the HIV viral load testing that happens in Africa. Remember, patients who are HIV infected need to get 2 viral load tests that looks at how much virus they have in the blood per year to inform their treatment, whether the treatment is working or needs changing. So we have played our role in terms of supporting Africa's diagnostics backbone in HIV testing in a partnership that has brought 42 African governments, USAID, a company called Chemonics, and many other partners to be able to deliver this result.
Hologic has been a leader in the innovative diagnostic technologies here. Perhaps how do you see these advancements playing a key role in eradicating specifically HIV and AIDS within Africa? And what are some of the barriers that are hindering this process?
Hologic has been a leader in medical technology and diagnostics, and throughout the last years, and since we have initiated a dedicated program to support the HIV in Africa, that we have been delivering innovative solutions such as high throughput diagnostics equipment, which allows labs to scale up their testing in a platform that is easy to operate and also has a relatively small footprint, which allows to actually adapt to many environments in the lab. But we also have developed new ways of collecting samples, like the dry blood spot, which allows to collect samples in most remote areas where sometimes it's difficult to transport samples to the main lab. And together also with other innovations in digital diagnostics, but also in what we call multitasking, taking advantage of our platform, which allow us not only to test for HIV, but also for other diseases like hepatitis or HPV, which we use for cervical cancer screening. So these are some of the innovations that we have brought into Africa. And I think what I would like also to highlight is that Hologic is putting in the region, in the continent, our best technology. So and we do it through our commitment to the region to fight HIV. If I think about barriers, obviously funding remains one of the barriers, and also the number of healthcare workers. Today, actually, in one of the panels here, the Honorable Rwanda Ministry of Health, he was explaining their plans to increase and scale up the number of healthcare workers from around 1 to 4 for every 1,000 patients. And so this remains one of the barriers to scale up HIV testing. Funding, in the sense that resources are not infinite. And so we need the collaboration from everyone and the commitment from all the partners, from the funders, from the local governments, to continue the funding and the support of the HIV programs, which took us so far until now in helping to the reduction of infections and reductions of mortality.
And through the solutions that you're coming up with, Africa is quite huge, and there's quite a lot, big number of people that are infected with HIV and AIDS. Therefore, how do you ensure that you take care of all the population and also the marginalized groups within the continent?
So we, Hologic, have developed our Global Access Initiative, which it's basically a program that delivers all-inclusive, transparent, cost-effective price to all countries that are working on scaling up their testing. And so with that, together with expanding our own teams in the region, with training and education, we have working with governments and partners to expand our presence and our innovative solutions into the regions, from central labs to the most remote areas. So we are very committed to reach to those more remote areas in the region where sometimes it's more difficult to reach populations.
Women's healthcare in Africa faces challenges such as limited access to maternal health care and reproductive health services. However, there has been strides in terms of promoting awareness and empowerment to drive change. We have a chat with Mokadi Mashishu, who is the Africa Access Director for Organon in Africa. Paint us a picture of the challenges and what the gaps in terms of dealing with women's health within Africa.
Thank you so much, Flora, for having me. I think if we think about healthcare in general, African women really bear the massive burden of disease. And there's a lot of disease that actually disproportionately impact African women. And the fact that there has been historically lack of investment in women's health makes the problem even more significant. And if we actually take it from a disease perspective, looking at non-communicable diseases such as hypertension, cardiovascular diseases, and diabetes, women, there's an increase actually in that space. And there's also an increase in gestational diabetes, which generally happens when a woman falls pregnant. And then another area of importance is cancers. And we understand that in the African context, a lot of women are only diagnosed very late in stages of diseases, and this actually impacts their access to healthcare. And this is impacted by things like lack of diagnostics, but we also know there's a lot of myths that surround health on the continent. And then taking it further, if you look at the rate of unintended pregnancies on the continent, it's extremely high. So if you look at the global statistics, about 50% of all pregnancies that happen on the globe are unintended. In Africa, some countries have as high as 65% unintended pregnancies. And I think another thing that is almost uniquely impacting Africa is the high rate of teenage pregnancies as well. And that is critical. We do have to take that into consideration. And you have mentioned maternal mortality, which is directly linked to the unintended pregnancies, because if we can prevent unintended pregnancies, then we are able to manage maternal mortality effectively, because you can prevent those risky pregnancies. And then there's also postpartum hemorrhage. Again, the statistics there are harrowing. Women in Africa represent 66% of all women that die during childbirth. And the reality is that no woman should actually die giving birth. So what are the things that can be done to ensure that women are safeguarded during that vulnerable space in their lives, but also to ensure that women are healthy so that they can then bring up healthy communities and healthy children overall?
Quite a number of challenges you've mentioned there. But then the conversation is, how do we address these challenges within Africa? Just moving from looking at the challenges and conversations to more of solution-based conversations.
And this is actually one of the critical things. So we launched the Coalition for Women's Health in Africa at the end of 2022 with the intention to drive exactly that action for women in Africa. And the coalition itself, we started off as 3 organizations, so Organon being the principal founding member, and Hologic and BD as the founding members as well. And we work closely with Africa Health Business as the secretariat. And since launch, we have actually managed to get together 18 organizations who are all united in solving for these challenges in women's health, because the reality is this is such a mammoth task that one cannot deal with on their own. So one of the key things that we actually decided on prioritizing was to gather data that can then be utilized as a way to identify those gaps, so that as governments put together strategies, there is a guiding document that we can also use for advocacy. Then we also put a lot of emphasis on advocacy, but more importantly, to your point, action. There is a lot of solutions that are available on the continent, but a lot of organizations work in silos. Can you imagine the domino effect that we will have if we combined our efforts and actually united for her to ensure that we can improve healthcare in a more transformational way?
And the role of women, may it be socially or economically within Africa, cannot be ignored. Therefore, how do we make sure that the conversation about women's health is brought to the broader agenda when discussing very important issues within the continent? It's not just a by the way.
Mm-hmm. That is actually a very critical statement, because one of the sayings that I truly believe in is that solutions shouldn't be made for the end users. So as we think about partnering for health, women have to be part of the conversation, including the young ones, because the days of children should be seen and not heard are long gone, right? So women have to be part of the conversation. We also understand that there's a lot of women in communities who are leaders in their own right in one way or another, who are driving improvement in healthcare. How do we ensure that we bring them to the table to form part of the solutions? So we should ensure that there is no one that is left behind. So civil society has a critical role to play in terms of improving and transforming women's health. And then the other issue is around leadership. How can we be solving for women's health issues without female leaders really taking the center stage and the actual leadership in solving problems that they fully understand? And the good news is that there's quite a number of organizations on the continent that are driving exactly for that, to build that leadership skill and ensure that we have good representation of women in key decision-making positions that will ultimately accelerate the attention on women's health and solving for these challenges.
There's a lot of health inequity within Africa. Paint to us a picture of the barriers that have led to this, and what is it that MSD is doing on that front?
Well, when you're talking about healthcare inequity and the barriers that exist, you really have to break it down into two things. Availability of medicines, as well as accessibility. I think the African continent has done incredible work with the introduction of the African Medicines Agency that's stationed here in Rwanda to address the availability issue. We've been able to ensure that there's regulatory harmonization that allows us to register products across multiple countries with a singular submission. And with that, I estimate it probably has sped up our process to registering products on the country by about 5 years. And so it really speaks to ensuring that innovative medicines are available for the patients that need them much earlier. The accessibility aspect is something else. I think that requires a little bit more work. I think the countries on the continent need to really focus on how to practically implement pooled procurement, which would leverage economies of scale and thus avail better pricing for medicines on the continent. I really believe that we've done some great work with a partner such as Gavi that has allowed us to reach approximately 14 million girls across the continent per annum with life-saving vaccines. And certainly I think the other step that we need to focus on is around ensuring that we look at the issue of tariffs, taxes, and in-channel markups. Anecdotally, if a product leaves a manufacturer at $1, it's more than likely going to reach the patient at $2. And certainly that doesn't speak to ensuring maximizing equity and access. And so we do need to work with policymakers to address that.
And it's good that you've mentioned the issue of policymakers. This is where we look at collaboration, being able to bridge the gap in health disparities within the sub-Saharan Africa. Therefore, what's the role now of the government, private sector, NGOs coming together to help solve these health disparities within Africa, as well as reach out to every population, even in the most marginalized countries within Africa?
That's a really good question. And all of the stakeholders that you spoke of have a very important role to play in the healthcare ecosystem. Last week I was in Ethiopia with the Africa CDC, really sitting with them and really talking through what are the practical sort of implementable things that we can do to expand access to healthcare on the continent. And in all this work that I do, I very seldom disagree on what needs to be done with policymakers. We often disagree on the how, but what needs to be done, we're almost always aligned, and that's always aligned with the absolute patient need. I think what needs to happen is we need to be more pragmatic through our discussions. Last week in Ethiopia and the discussions this week, I don't think we need to come up with more solutions. If you look at the people in the room, the discussions that we have been had, the solutions are there and people know what interventions need to be made. I think we need to be brave enough to implement them. And whether that be policy change, whether that be to be brave enough to consider more nuanced ways of procurement, to be brave enough to consider actively driving for the introduction of innovative medicines on the continent. That's a decision that can be made by individual policymakers and all the other stakeholders, be it manufacturers, NGOs, funders, etc., will coalesce around making it happen.
And when you started this conversation, you mentioned the issue of accessibility, but then there's accessibility and then there's the issue of affordability. How do you strike the balance, considering most of the African countries, they're not at par in terms of even the economies and the spending power of the people?
So I think that's a really good question. There's a number of things that we do. So the one element that we do is around donations. So there's a significant amount of medicines that we donate as an organization. In fact, we've got one of the longest running donation programs where we donate a product called Mectizan. It's been running for 30 years. We reach about 300 million patients per annum, and we will continue donating that medicines for free for as long as people of the world require it. That's the first one. Then we address this issue through partnerships with partners such as Gavi, where we provide vaccines at a deeply discounted rate for underserviced communities within low middle income countries. The third aspect that I think Africa now needs to focus on is around innovative procurement mechanisms, otherwise known as expanded access programs, that are grounded on the principles of shared value. And certainly I think if we're able to tap into that and have governments actively engaging in those discussions with us, it could certainly completely transform the access to quality, innovative medicines on the continent.
So to kick us off, what is it that drew you to host this event in Kigali, Rwanda?
So just a bit about Informa to start with. We're a global events organizer, global events company. I'm personally based in Dubai, but I look after the region of Middle East, Africa, India and Turkey. We've historically done events in Africa, particularly focused in Egypt, Nigeria, Kenya and South Africa. But this year is the first year that we've come into Rwanda to organize events. And we've actually already this year organized an energy event called Africa Energy Expo. That was 2 months ago. And now this is the first ministerial summit that we've organized for the healthcare sector. And we've chosen Rwanda to do that because Rwanda offers almost like a hub location, which is very attractive for us. Like you said earlier, we've had 20 countries visiting this show. This is the first edition. This is not a an event for Rwanda. This is an event for Africa, and it was very important for us to find a location that could deliver that for us.
And looking at the International Health Ministerial Summit, the very first one being held in Rwanda, perhaps talk to us about what is it that drew you to look at this specific sector, and how does it align to your mission to have impactful events like this and impactful conversations for impactful and very pertinent sectors like the health sector?
So Informa is a very strong player in the healthcare sector. So we own Arab Health, we own Medic East Africa, Medic West Africa, Africa Health in South Africa, also activities all across Asia, and also in North America. So the healthcare sector is a very important market for Informa. But most of those events are trade events. It's about product buyers and product sellers meeting and trading. This event is quite different because we're really addressing policy and strategy for the sector for an entire continent. That's why the format is different here. We have 16 ministers in attendance from across Africa. We have all the sort of, and it's an invitation-only event. This is not an event that's open to sort of every professional in the industry. This is invitation-only. So this is a new format for us to try to get into a level of discussion in the healthcare market that is beyond the normal trade market that we're in, into more policy making and discussion around healthcare strategy.
And beyond networking and collaborations that are opportunities presented during events like this, what more do you see these events bringing in terms of even economical growth within the African continent?
The economic impact of our events is something we often talk about when we're going in to speak with countries about bringing events. And it's such a broad impact that events like these can create, because you're not just, there's an impact from the business tourism that comes to the event. They come and stay in hotels, they go and eat in restaurants, and they spend money in the country. They also form partnerships while in the country. They might set up operations in the country and start to think about manufacturing or putting a branch office in the country. So honestly, the economic impact from events being hosted in countries like these is enormous. And we really do want to focus on that as much as possible, because that's really why it's a win-win for the industry, the organizer and the country.
Thank you for joining us on Focus On. From transformative discussions to actionable insights, the International Health Ministerial Summit has set the stage for a healthy future. Goodbye for now.